Study from the National Institutes of Health found that permanent hair dye and chemical hair straighteners can put women at a significantly higher risk of breast cancer. Dr. Timothy Quinn, who practices family medicine in Ridgeland, joins us now live to talk about that research. First of all, Dr. Quinn, can you go over those numbers with us?
Yeah, I mean, this was a very fascinating study. It was published in the International Journal of Cancer. Basically, with this study, now, first of all, the women that participated, which were 47,000, all had a sister with cancer.
Okay.
So they already had a very high risk factor as far as a family history. But of these ladies, the ones that said that they use hair dyes or chemical straighteners, the Caucasian ladies had a 7% increase as far as their risk of getting cancer, but the African American ladies had a 45% risk. So this is very, significant. But as they went on, the studies revealed that if they use it more frequently, like say 5 to 8 weeks, it went from 7 to 8% for Caucasian ladies, but for African American ladies, it went from 45 to 60% risk. So this is a very compelling story, and we hope that more information will come along with more research, but also the FD, basically there'll be more investigations to check for safety, because this can be very potentially dangerous.
Absolutely. Now, what is a permanent dye? How long does that have to stay in to be considered permanent?
Well, basically, the study did cite the fact that the dye that caused the cancer risk were permanent dyes, meaning these dyes had more carcinogens and the chemicals. But the temporary dyes, the ones you can wash out after a few days that didn't last forever, they had no correlation as far as increasing the risk of cancer. So basically, it's advised, if you can, maybe try to use the temporary dyes as opposed to the permanent dyes, because there's much less risk.
Absolutely. Now, to have a temporary dye, some people just don't want to give up their dyes and straighteners, though. So you're saying go temporary with that?
We'll go temporary. But as far as breast cancer, there are multiple factors that cause breast cancer. It's not just one thing. Now, note, as I said earlier, in this study, all the ladies had a sister with breast cancer. So they were already at high risk for developing breast cancer, much more so than the general population. But if you are someone at high risk, then you want to try your best to decrease any other risk. So as far as like this study, you might want to think again about using those hair dyes and those chemical straighteners, because you're already at high risk if you have a sister with breast cancer.
I understand. That is good information, especially for African American women. They are at the highest risk for this sort of thing.
Yes, and a few weeks ago, we did talk about a program with the Mississippi State Department of Health for ladies out there that might not have health insurance. If you go visit the Mississippi State Department of Health website, there's information how you can get free, no cost mammograms and breast exams, basically if you don't have health insurance. So that's a resource that we can use. And as a primary care physician, I advise all ladies to get screened for breast cancer, especially if you have a high risk, such as the ladies in this study that have a sister with breast cancer.
All right, Dr. Quinn, if we could switch gears for just a moment. A lot of people come together for the holidays in close quarters, spending a lot of times indoors. What are the illnesses that are making the rounds this time of year, and how do you stay safe?
Well, actually, it's crazy. The flu is still out there, and it's so aggressive this year. We had 2 cases this morning. Whoa. So it's so important, if you start to develop, runny nose, cough, body aches, chills, go ahead and get checked out, because the deal about the flu is if it's diagnosed early, meaning you don't delay going to be evaluated with a simple flu swab in the nose, which we have the results in 3 to 5 minutes, go ahead and get on the Tamiflu, which your medical provider will prescribe, and it can drastically decrease the symptoms, and save you a lot of unnecessary pain and suffering.
All righty, Dr. Timothy Quinn, thank you so much. Practices family medicine up in Ridgeland, and thanks for taking time on your Thursday to come